comorbidities, most commonly hypertension, diabetes, and in some respects also obesity are some of the comorbidities that we are seeing frequently. I want to take the opportunity, though, that to emphasize that some patients unfortunately have comorbidities but do not know. And so they may present at the time of presentation with a comorbidity that they may have had but not previously diagnosed, and not necessarily always diagnosed even at the time of presentation. We have seen other cases where patients do not have comorbidities, but they are not the majority. We have seen a very few number of patients who are younger, very, very few, also without comorbidities, not predominant. What we're seeing is more of a hypertensive, diabetic, elderly population with some form of comorbidity.
As long as we have one or two people, or a few people in that population of 99% of the population, as long as you have some people in there who are designated spreaders or accidental spreaders, the situation is that the virus could be spreading amongst us. That is why it's so important that we place our expectation and our hopes on the personal conduct in denying the virus, the person-to-person contact. And because we have not seen the level of reduction that we want to see to allow us to have the level of risk that we want to take, we must continue to do what we have been doing so as to get the result that we are after. So therefore, today I will simply ask that we continue up until another cycle, to the 28th, to the 20th, to the 11th of October. The stay-at-home arrangements for the public service would remain, the rotations would remain, and with one adjustment where, because, as I said, we have to continue to do what we have to do, lives and livelihood, remember those two terms, we are in the budget period. The budget is due. The date has been given, October 5th. All persons in the public service who are required to work on the budget exercise in every ministry and the Ministry of Finance, you are deemed here to be essential and you're required to be at work, and I would leave that to the head of the public service to talk to the permanent secretaries in the various ministries to ensure that the persons to whom this stay-at-home applies are not those persons who are required to be at work to assist with the budget preparation. And by this I mean the Ministry of Finance and the finance people in the various ministries. They are now deemed to be a new ailment that was observed to be going through the population in the United States. It was first determined to be a Haitian disease, only because among the early people who had tested positive for this disease were a few Haitians. And very quickly, that period of time, the conversation was Haitians, and that caused a lot of pain and pseudoscience until it became known that it was a human condition, not confined to any geographical location or any demographic coming from a geographical location. So when I hear talk about Venezuelans, it's easy to say, but it is not supported by the fact. Because we have 16,000 Venezuelans in Trinidad and Tobago. I would be surprised if they are immune to this virus. And of course, they may be living in conditions. That's another thing that we have to be cognizant of. The virus has a certain kind of propensity to move in the conditions within which certain people live. If you're following the international news, you will see that. And it is saying that it is those persons who are in the worst living conditions who are having the worst ravages of the virus. And immigrant populations tend to be in that category. So let us stay with the facts. We will not hesitate to tell you if it is that our source of the problem of keeping the curve high is Venezuelans. But it's not supported by fact. We have neighbors in Venezuela. We have Brazilians down south of us. We have Central Americans. We have Caribbean people. As I told you in the meeting we had yesterday, it was a whole day of what we were hoping to achieve yesterday was to create a bubble where our Caribbean island people, CARICOM people, could begin to move among ourselves. We could not come to that conclusion because the circumstances didn't permit it. We would love to come to a conclusion where let us create a bubble. Trinidad, Tobago, Grenada, Barbados, and Lucia have a CARICOM movement. We could not come to that conclusion because it's a human condition.
Mr. National Security, Prime Minister sort of stole my question. You made mention of the word intervene, and the police officers can intervene in both private and public. Could you clarify what intervene means, specifically because the Commissioner of Police was saying that he could have intervened at Bayshore Bayside, but he could not have arrested. What do you mean by intervene?
All right, well, I mean, first of all, the Commissioner of Police wasn't involved in that operation as far as I was concerned. The law is that any police officer has a power of arrest. Any police officer that sees or has reasonable grounds to suspect there's about to be a breach of the peace or someone's life put in danger, someone's life put at risk, they can intervene into that scenario and do what needs to be done to protect life. In a pandemic situation such as the one we're facing, and as we've spent the last hour plus here discussing, and we're all aware of, it is the spread of a virus that is potentially deadly. We have been implementing a number of things. Don't gather, be socially distanced, practice certain protocols so as to not spread the virus. So if there's a risk of that taking place, and this is a discussion, so parties in areas, the police can use that power of intervention. There's no magic in the word intervention. I mean to literally get into the situation and do what needs to be done. I wasn't there. I don't know the circumstances as to what took place, but police, as you know, have powers of arrest. I mean, you have it all the time. One of the things we've discussed throughout, for example, with the bar setting, is I've asked the police, if you see people congregating, breaching the protocols to get to the regulations, ask people to disperse. If they don't disperse, then arrest them. So it's that type of setting. Whilst I have the mic, Prime Minister, I'm just being told that a message has been sent here. 259 tickets have been issued for persons not wearing their masks, right? That's the figure. There's just one other point I'd like to raise because persons are asking about it. Permanent residents, we want all permanent residents who are stuck outside to know that we're not going to revoke your permanent residence because you haven't been able to get back here within the space of the year. I'm giving the instructions to the Immigration Department as the Minister of National Security that what I shall be doing is having a sort of amnesty because we recognize persons couldn't get back here, the borders were closed, so you don't need to worry that you haven't been able to get back within the space of a year, you're going to lose your permanent residence. Thank you, Prime Minister.
Going to the judgment, part of it, there was an advice that the Parliament...
You can ask me that as the Minister, you can ask me that as Short Young of Council. Yes.
That that the Parliament be involved in or have some sort of oversight?
Thank you for bringing that up. Yes, the media and other persons grabbed onto that sentence of the judge. It is what we call in legal jargon, obiter. So it is not the decision of the court. It wasn't a factor that was determined by the court in that case. What the court was saying, and when you read the context as to where the court got there, the court was saying, listen, you have to be cautious about using regulations to establish criminal offenses. And if you're going to use regulations to establish criminal offenses, it should really be part of Parliament. However, not in these circumstances. So the court recognized that with the public health ordinance, and I think he quoted cholera and yellow fever in the past, it can be used, and it was rightly used. So he's not saying that now, as we're about to publish today new regulations, we should go to the Parliament under the public health ordinance. He's saying just be careful, and in the future give consideration if there are other pieces of legislation where you have the power to pass regulations. Don't go about passing criminal offenses attached to those regulations. Those are things you should always be cautious about and maybe put it before parliamentarians for debate. But it was not linked to the present public health ordinance regulations.
So will you be taking the advice and going to Parliament?
But I just explained, or try to explain, it doesn't apply to here. I mean, when you read the judgment, the court actually recognizes that in these circumstances, an executive needs to move expeditiously. He actually complimented the government, saying that you can see that there's constant review taking place by the number of times the government, have amended the regulations and are taking the advice of the public health care experts, and he found all of that to be proper. So that one sentence that was grabbed onto is not applicable in the present circumstances.
But Minister, so since you're giving us a little bit of legal advice, right? What is the protocol? Should any member of cabinet be infected with COVID-19, have to quarantine, have to be treated at hospital? Are they still fit to work?
The answer is yes. I mean, there is no difference, as the Prime Minister said, as he said 100 times from the pulpit, so to speak. And I'll use the opportunity to repeat it, because I said it in my last contribution in Parliament. COVID doesn't respect your race, it doesn't respect your creed, your religion, your age, your social stature, how much money you have in the bank or you don't have in the bank, where you come from. So if any member of cabinet, and it is always possible, contracts COVID, we are then in the hands of the CMO and his health experts, and we will be treated as such.
Let me just say that there's no need for us to make these separations here, because we've already had in Trinidad and Tobago, the highest office holder has responded by being quarantined in response to an exposure. The president responded. We've had a head of state who had COVID and died. We've had a head of a major nation go through the hospital care for COVID. So there's no difference between an office holder and John Public in the street where this is concerned.
I understand that, but I wasn't asking about how they would be treated. I was asking about would you still be able to perform your function as a member of cabinet while in quarantine or being treated for COVID-19?
Well, let me answer that. We tell people, if you feel sick, stay at home. Okay? That ailment that you are that sickness that you're feeling, and you stay at home in response to the CMO's directive, could be that you have COVID. It also says that if your condition is such that you are concerned about it, contact the health department. If your condition worsens, contact the health department. But if not, just stay at home for the 14-day period. So let's assume, God forbid, that I don't feel well tomorrow, and I am following the instructions. You don't feel well, stay at home. Well, you know, whilst I'm at home, I do a lot of work on the phone, so I can do that still. I have to stay away from you. I have to stay away from my colleagues here, and even my family, my colleagues. A lot of work goes on at the residence of the Prime Minister. So yes, it depends on the level of your ill health. If you are, I saw one of my former parliamentarian was in the hospital. a former colleague of mine was hospitalized. So it depends. But if you test positive and you're put to home quarantine, if you are not physically distraught and distressed, you may be able to continue. If you can't, well, then there's a provision for that. You then will have to be replaced. And what happens is that the president is informed that the minister cannot function and someone would be made to act for that person. That is that normal? Recently we had one cabinet minister who had to have medical procedure done, and that was done. That's a protocol. Once you are in a position not to be able to function at all, then you are replaced by a person to act for you.
Okay, and in your opinion, Prime Minister, you'll be getting feedback. How has this work from home thing and rotation been working out so far, especially in public service? And are there any plans to continue that post-COVID?
I hope so, because what has happened is that a certain amount of efficiency has been brought to bear on the carrying out of public business using the technology. For example, we have a CARICOM meeting. We used to have to pack a bag, get to the airport, get to a hotel, we all get together, and that usually was a 3-day thing, a 1-day travel, a 1-day meeting, and a 1 shot. That was 3 days. Now we're having meetings as frequently as required, probably a little too frequently, because all you need to do is to order a meeting, and it goes very, very well, and it's very efficient. And I expect that the same thing is happening in areas where the technology is utilized. That being so, when we get back to normal, it is to be expected that those developments would factor in, especially here in Trinidad and Tobago, where even before COVID, we were aiming to become more technologically advanced. Steps have been taken. You would have seen the cabinet being adjusted. You would have heard certain things being done for us to become more attached to and attuned to the use of technology in public administration and governance of the country. And I have every confidence that when this is all over, one of the things that you will see is a continuation of a lot of the positives that arose in response to the COVID. You know, when President Kennedy said that man was going to go to the moon, a lot of people thought that that was just something to do. First a dog went into space, and then man is going to go on the moon, something to do. But if you ever had the opportunity to look and see what happened with respect to technological advance in response to the moon program, it is absolutely amazing. You know, what has been discovered and put to use and is now commonplace because it came up in the space program. And I think the same thing is going to happen with COVID-19.
I have a question to CMO that I didn't get a chance to ask.
CMO?
Sorry, I'm taking advantage of having more than 2 questions. Go ahead. Would you be in a position to state how many, or have we had any instances of patients of St. Anne's testing positive for COVID-19? And I'm hearing a rumor that one of them may have escaped. I don't know if you could put that to rest.
So there were patients in the facility that tested positive. I had spoken to the chief executive officer regarding it, and they have a team comprising of the chief of staff as well as the infection prevention control department as well as OSH, ensuring that there's no spread in that facility further. Of course, prior to getting the positive, there would have been some contact, so all of those persons would be treated as primary and secondary contacts as per usual, but that is being managed by the chief executive officer of Northwest Regional Health Authority.
And also I would have instructed the chief executive officer, and they have already found it, a site within the compound, so any person with mental illness can be housed away from the general population of St. Anne's, and any other mental patient from throughout the country can be brought to that central location so they don't mix with the general St. Anne's patient population.
Okay, and now I know the ministry is trying its best to deal with that backlog of tests, but as it stands, we're seeing, and I've gotten numerous calls from people being affected by it.
Yeah.
Right? For instance, one person called me today and said that their father had a heart attack at Fernando General Hospital, but the swab was taken as a precaution, and the family was told that they now need to seek a procedure that needs to be done privately, but that backlog is preventing them from getting that done. So what contingencies are being put in place in light of this backlog?
Right. So in terms of what has happened since I spoke last on the issue, we have gotten into the country. I know Minister would have said we got about 8,000 plus Abbott kits. We got the consumables in the middle of the week. So we have 3 additional sites: North Central, the MRF-TT, as well as Southwest. So that particular patient would benefit from Southwest having their own capacity. They can do at least 200 tests per day, and they have so far done about 280 within the last couple of days that they have been working. So they can, for the entire Southwest Regional Health Authority now, they have the capacity to do those tests on their own without sending it up to Trinidad Public Health Lab and going to another lab. So the national capacity has gone from somewhere about 600, just over 600 per day, to 1,287. So our swabs coming in per day, roughly about 700. So we have a surplus in terms of capacity at this point. With that being the case, we hope, of course, going forward into the next couple of weeks, we'll be in a much better place to respond in a timely manner. If you have noticed, even in the updates, we sort of decreased to about 5 to 7 days in terms of the response and the way we are dealing with the backlogs that occurred. But we're hoping as the numbers continue to increase with our increased numbers, meaning that the swab numbers remain the same as well, we hopefully that will either stay the same or go down, then our capacity will be such that we will be able to manage.
Let me just go back to the Southwest situation. We did actually activate the Southwest PCR machine 2 days ahead of schedule. So we started it on Wednesday. That is the only thing that happened before time. They are doing 94 per day on one run. We are taking our time, and by middle of next week, we will start to do 2 runs per day, and then hopefully 3 runs per day. So let's say every run is about 100, 94 to 100. So right now we have done 282, 288. That will go up in the coming weeks. Okay?
Would you be in a position to say the antigen rapid kits that we were getting, we did not get an exact date of when we expected it to come. Do you have a...
So I can't give you an exact date. We have to wait on the manufacturer. It's in a production line now. As soon as I have a concrete date, I'll bring that to you.
I have a question for everybody on the table. I'll start with the CMO. 5 minutes. CMO, can you give us a ball by ball what happens after someone dies from COVID-19?
Well, I have been avoiding, to be honest, going a ball by ball because of the nature of what happens after someone dies from COVID-19. Suffice it to say, there has been a guideline in place since March, which the funeral agencies are aware of, the heads of pathology are aware of, and all the hospitals that treat COVID-19 are aware of as well. So I will leave it at that. The guidelines are available. I don't want to go into the details because I don't think the details for the families that have lost loved ones would help them any at this point. So we'll leave that for the guidelines.
I'm told that families have no choice in the funeral home that does the burial or cremation.
There's an assignment based on the RHAs. So the RHAs would have had a list of, they would have met with the funeral agencies to determine who had the capacity to meet with the criteria set out in the guideline to ensure that the proper protocols can be followed. And the RHAs, mainly North Central Regional Health Authority, together with some others, I think Southwest, would have been putting things in place through their normal procurement process to get those agencies. But those agencies are the agencies that will have to deal with the COVID-19 bodies. Not every agency can do it and do it at a standard that we are happy with at this point.
And who foots the bill, the government or the family?
I think the RHA, I believe the RHA, Minister, I don't know. I believe it should be the RHA, but we can get back to you on that one.
We're 5 minutes from 2 hours, so I would like to wrap up on 2 hour mark. So we have 5 minutes more, so if you have 1 2-minute question, we can get 2 of those and then we'll be out in 2 hours.
Minister, have you received the pre-action protocol letter from one of the families who died from COVID?
So I will continue to tell the country that anybody who has COVID can be guaranteed that the Minister of Health will not discuss any family's private business in the public domain. let the course of action that any family wants to take place happen. But as Minister of Health, I have. Health is based on patient confidentiality, and I will not be breaching that from prince to pauper.
Last question. Let's have the last question.
In the years gone by, we've seen national security take up the majority of the budget. Do you foresee the health aspect of it overriding that?
I'll ask you to be patient until the 5th of October. I can guarantee to you that the Minister of Finance and his team, they are at work. They have been in contact with the Office of the Prime Minister and elements of the Cabinet. There's a lot of work to be done between now and then, and I'm sure on that day you'll get the answer. Just let me end on this note. A few years ago, I was somewhere in the western side of the United States. I was working on a volcano there, and I came to town. Went to a party, and I'm speaking to the person who asked about what police intervening means. I was in this party, and there was a good party going on. Music was playing, and a lot of good people around. And all of a sudden, immediately, the music stopped. And I looked, and I saw the organizer of the party by the door talking to a police officer. And I walked towards the door, and the officer by the gate spoke to me inside the house saying, "You go back." And I was close enough to hear him telling the organizer of the party that there was a complaint from the neighbors that there was loud music being played in this house. And if this party is not wrapped up in 5 minutes, I'm taking everybody down. And here I was from Trinidad in a party somewhere in New Mexico, don't know where I was, didn't even know whose party it was, and I was in line to be taken down. And I'm sure that would have made headline here in Trinidad and Tobago, right? But so intervention means law enforcement for public purpose. And we are all now subject to the public health ordinance because we are in a public health emergency. I thank you for coming, and I thank you for listening. Thank you very much.